Future doctors, let's master the clavicle bone in very simple, smart and effective way. Clavicle is a bone of upper limb which is also known as collarbone or beauty bone. It is placed horizontally in human skeleton system. It is basically divided into two parts. One is medial end which is also known as sternal end, and the second one is lateral end which is also known as acromial end. Now let's move to the side determination. The lateral end is flat and the medial end is large and quadrilateral, whereas the shaft is slightly curved. The medial end is 2/3 part and the lateral end is 1/3 part. Now let's move to the parts of clavicle. The first one is medial end. As I mentioned before that it is the 2/3 part of clavicle. The medial end contains a large facet where articulates manubrium of sternum and form sternoclavicular joint which is also known as SC joint. The upper part of medial end is rough and give attachment to interclavicular ligament, capsular ligament and articular disc for sternoclavicular joint. Now let's move to the second part of clavicle, that is lateral end. It is flat and concave forward. It bears a small oval facet which articulates with clavicular facet on the acromial process of scapula and forms acromioclavicular joint, that is AC joint. I know it sounds little confusing, so let me summarize it again. So basically clavicle has two parts, that is medial end and lateral end. Medial end, which is also known as sternal end, it forms SC joint, that is sternoclavicular joint, and the lateral end, which is also known as acromial end, it forms AC joint, that is acromioclavicular joint. Now let's move to the clinical anatomy of clavicle. A junction of lateral 1/3 and medial 2/3 is the most common site of fracture of the clavicle because of the changes in curvature of bone and transmission of weight of upper limb. So this is all about clavicle. I hope it was helpful. Learn once, remember forever. This is how toppers revise anatomy. Comment the next bone you want.